The orientation of the subtalar joint axis differs between individuals and even between the left and right feet of the same individual. It is an important factor in understanding where and how much force is needed to have a functional effect. An orthotic is designed to apply an orthotic reaction force, or ORF, to the foot. The position of this applied force relative to the joint axis determines the result. As the orientation of the subtalar joint axis changes, the area medial and lateral to the joint axis changes, as well as the moment of the force. Orthotic reaction force applied medial to the subtalar joint axis will have a supinatory moment, while an orthotic reaction force applied lateral to the subtalar joint axis will apply a pronatory moment. Force applied on the joint axis itself will have no net effect. An understanding of the joint axis position allows the application of force required for the foot type, biomechanics, or tissue stress caused by pathological forces. Clinical tests include the subtalar joint axis location test as described by Kirby, in which the location of the axis from the posterior lateral calcaneus through the talar head is marked by palpation, or plotted on the plantar surface of the foot. The manual supination resistance test described by Payne aims to classify the amount of force needed to be generated to have a supinatory effect on the foot. The amount of force needed is classified as 1 easy through to 5 hard. It is then used to determine the orthotic variables needed in the orthotic design. The higher the MSRT force, the more aggressive the orthotic features need to be. For more information on DOLA Orthotics, visit dolaorthotics.com. Subscribe to our YouTube channel or follow us on Instagram or Facebook.